So the trick about vitamin D is it's actually more of a hormone than it is a vitamin. You want to think about it in that way. Our body can make vitamin D when it has adequate exposure to the sun, so we don't necessarily need to ingest it. But because we're all afraid of skin cancer, we put sunscreen on our skin, and then that blocks our ability to make vitamin D. So many Americans are deficient in vitamin D and don't even know it. So a lot of times when people are thinking about taking supplements, they'll hear the advice that they should get these nutrients from their diet. And ideally you would. If we lived in a perfect world, we would all eat really healthy diets that were rich in fruits and vegetables that came from wonderful soil that allowed them to grow their nutrients optimally. Unfortunately, most Americans don't eat an adequate amount of fruits and vegetables. And perhaps the ones that they eat are not nearly as healthy as they were when our ancestors used to go and pluck them from their gardens and from their fruit trees. Many people will choose to take a supplement that contains omega-3, most commonly fish oil, and this is to balance out their diet. So most of us think of omega-3 as being beneficial to the heart, really protecting you from having heart attacks. But we know too that omega-3 is an anti-inflammatory, so it can help in other ways as well. Multivitamins are the most commonly ingested supplement here in the United States, and for good reason. We'd like to think that all our nutrients come from our diets, but since they don't always, it can be good to have a multivitamin on board, especially as we go into the winter months where maybe you're traveling or you're getting colds and flus or you're eating foods around the holidays and events like that. I think a multivitamin is a really good idea. The most important thing about a multivitamin is you choose one that's well matched to you. So sex specific, take a women's formula or a men's formula, take a 50+ formula if that fits you. And I would highly encourage people to look down the list of ingredients and make sure that they have around 100% of the RDA for each of the components. Certainly not much more than that. A lot of people have trouble taking multivitamins because they're so big. And one trick for that is to look for one that's low in calcium, because that's the biggest component, and then the pill will be smaller. I think of multivitamins as being a seatbelt. It doesn't replace safe driving like a healthy diet, but it is kind of that safety mechanism that could be added on board to support your immune system and overall health in general. Antioxidants are a little controversial. They're very wonderful when they come in foods. We think of antioxidant foods like the dark berries, for example, and people should eat those as much as they would like. But regarding antioxidant supplements, there can be some toxicity associated. So particularly if you look at very high doses of some of the forms of vitamin A and vitamin E, they're even associated with an increased risk of death. So I avoid antioxidants in general. I do recommend vitamin C for patients who are starting to have colds or flu symptoms. I think the earlier the better. While the science isn't very strong for that, that's a very traditional use of vitamin C and something I use myself. So the USP, the United States Pharmacopoeia, has created a seal, and there aren't a large percentage of the total supplements on the market who have achieved that seal. But if you see the USP seal, you know the supplement you're taking has what it says it has in it, and you can take that with confidence.